Hello, how's everyone? I trust that everyone is doing well and faring well through this COVID-19 epidemic, and that it hasn't touched your family, and that we get out of this as swiftly as possible so that we can get back to some sense of normalcy. My name is Stuart Anderson. I'm a native Washingtonian. I grew up in this city. I currently live in Ward 8, have been in Ward 8 the last 15 years. I was educated in DC public schools. I'm a big advocate for DCPS. I also graduated from the University of the District of Columbia, so I'm all homegrown. I'm currently running for the Ward 8 City Council seat because I believe that the residents of Ward 8 deserve a stronger leadership. I think that we deserve a more consistent leadership. I think that we need to be able to have some idea of where our leadership is going to take us. And that's what I want to be able to do. And I want to do that with you.
Great, thanks. So go to the first question, which is approximately 90,000 families live in apartments that are under DC's rent control program, which is currently up for reauthorization. The City Council's temporary universal ban on all rent increases exposes the need for increased tenant protections. What changes, if any, would you make to DC's rent control laws?
Well, basically, I'm for extending the current rent control laws for another 10 years. I'd like to say that off the top, taking this all the way to December of 2030. As a council member, I would look to do a number of things with it. Part of the problem with the rent control right now is I think that adding that extra 2% on top of the inflation is a problem. I think that we need to look at the voluntary kind of agreement situation where they ask people to, you voluntarily agree to give up these rights and we'll do these improvements and things. I think that's trickery. I think we need to pull that out of there. I think that we also need to look at not just the provisions around the inflation, but how it's actually applied, because it's not applied fairly based upon some of the stuff that we're seeing in relationship to how it affects the tenants. And we need to protect tenants more. So I think that we look at it because it's an old law. It's a very old law. I'm glad that we've been able to keep it in place as we move along, but I know that some things in there need to probably come out, some things need to be stated better, and some things need to be put in there to make it more stronger.
Great, thank you. The City Council has enacted legislation that prohibits rent increases during the state of emergency and evictions until 30 days after the public health crisis has been ended. We know that nationally about a third of tenants could not pay their rent on April 1st. And given that over 87,000 DC workers have filed for unemployment last month, the statistic may be higher in the district. While the courts are closed to the public, until recently, landlords continued to file eviction cases online so that they could push evictions through as soon as possible. As the crisis continues, tenants are going to fall behind on their rent and accrue debt. What would you do to address this if you are on the council now?
Okay, so we're out on the council now. As the crisis continues, I believe that tenants will continue to fall behind. I would draft and submit new legislation which would protect tenants from evictions for at least 6 months following the reopened designated date. I would recommend that for those experiencing undue hardships, that landlords adjust people's rents by adding the old rent evenly across the next 6 months. So I'm saying that for the immediate 6 months, for this period and over the course of the 6 months following when we think that it's okay to reopen everything, that rent should be suspended, but people, you owe the rent. And then I think that that should be some kind of a negotiation between the tenant and the rent, because some of us can pay faster, some of us can. But at a bare minimum, I think that we should spread whatever's owed over 6 months at least, so that everyone is protected. The owners get their money. It just comes at a later date. And as for the courts, I think that this will also help the courts. I know that they will be overburdened. They probably, once they walk in the door, they're overburdened with large caseloads. So this plan would also serve to help courts catch up on caseloads and things of that nature.
Great, thank you. The DC Housing Authority states that the 6,600 plus units of public housing need up to $2.5 billion in deferred maintenance and capital improvements. The agency has charted a 20-year redevelopment plan. What would you like to see happen in public housing? What would you do?
First, I'd say I'd like to see public housing live up to its intent. Public housing wasn't necessarily meant to be permanent housing. And I think a way to help improve the lives of people is what it was about. That if you fell into hardship, you could go into public housing and give you an opportunity to get yourself on solid foundations. I'd like to see that whatever portions of the 2.5 billion, I think that's what you said, 2.5 billion, whatever portions of that amount of money is for deferred maintenance, that not continue to be the case. That we know now that we don't have to have that much funding set aside for deferred maintenance, because, I'd like to see us take care of maintenance issues as we go, so they're not deferred. Somewhere I said in one of the answers that I responded that DCAH should be on top of repairs. That they should be responding to repairs to the units in a more amenable and readily fashion, and that I believe will decrease the failed maintenance issues in the beginning. I will work to have subsidized, affordable housing more equitably kind of built across the city. So that means dispersing some of it, not having most of it east of the Anacostia, but putting some of the subsidized and affordable housing in other parts, other wards across the city. And as council member for Ward 8, I would urge my colleagues to join me in holding the mayor to her words to balance out, because I've heard the mayor say that she wanted to redistribute subsidized and affordable housing in areas where the percentages are far less than they are in Ward 8. So I'd like to, just hold her feet to the fire. The plan would have a fixed but flexible kind of timeline for a number of additional units.
Thank you. So from encampment clearings to the threat of COVID outbreaks in homeless shelters, we know that DC's homeless services programs are not working for many residents. How would you ensure that all DC residents have safe, quality, and affordable housing?
Wow. I'm going to take an opportunity to do a shameless plug here, is that, I've been talking about this closure of the halfway house and what that means for returning citizens. I had already been advocating we needed more halfway houses, and we also need some transitional houses to absorb, because a lot of our homeless people are people who are coming home from prison. That's just the case. DC housing challenges require some bold solutions. If we're going to ensure that all DC residents have safe and quality, affordable housing, and that returning citizen population needs to be included in all of our thoughts and tabulations for responding to our homeless crisis. The LGBTQ community. We have a lot of young LGBTQ residents in our city who are homeless, who are couch surfing, things of that nature. And so we need to be able to do something about a commitment to doubling down on the DC Housing Production Trust Fund. I think that $200 million would be a great start. I mean, looking at what was, $100 million back in, 2014, 2015 was great. And as I said to an earlier question, what was great 5, 10, 15, and even 30 years ago can't be great today, especially when we look at the cost of construction. We know that the cost of construction has increased, and therefore we have to increase our investment in making sure that we can provide housing for most of, if not all of, our people who live in this great city. So, I just think that a one-third fewer houses being built today is not enough, and that's what $100 million. That's what $100 million buys you.
Okay. So this is the 1 minute, the quick question. We've talked about DC's affordable housing crisis with respect to rent control, public housing, and homelessness. What would your top 3 priorities be for housing as a council member? And you can just list them.
Yeah, we got three kind of housing arms, and so I'd like to meet with the heads of all of them and really get a sense and an idea of what their plans are. I want to go on a listening tour throughout, the city, to look at the cities, focus on Ward 8, and then the listening tour in Ward 8. And the final thing is to look at the internal housing conditions of what we have, assessing what our current stock is. So when we assess what our current stock is, we'll know what we need to do moving forward.
Great. The impact of the coronavirus has also revealed the lack of a real safety net for workers in DC, particularly undocumented people and those working in the informal and gig economies. How would you address these issues?
Okay. So I've been engaged during this pandemic with a group who are focused on just this topic. I think that a lot of what we've been doing since the COVID-19 touched American soil, so to say, on a daily basis, we understand what the feelings and emotions are of workers who have no safety net. We've been talking about these gig workers and people who do fitness training, stuff like that. Across the gig economy, the independent contractors, everybody's bracing themselves for this drastic drop in income. And we're hearing the stories every day in the news, in the updates, in the reports, rideshare drivers, nannies, and other caregivers for the elderly. One of my daughters actually does some care. She just left. She goes and she stays with a group of people. And so their whole sense of livelihood is at stake. Many of the freelancers and the house cleaning people are among those who feel and we out there and we're talking to them, we're providing some provisions for them. And so we feel the pinch that they are feeling as a result of the economic pressures around this. And so flattening the curve is a must. We got to keep working on that. But I will work on a long-term addressment for supporting such workers, almost like I was talking about with the housing, to ensure that they have some sense of income to offset the immediate problems that is being caused by people not being able to take care of themselves because they can't go to work.
Great.
And I think I might have kind of stretched that one a little bit, but.
You're good. Last question. The coronavirus pandemic has brought to the forefront issues of systemic inequalities in DC. We know that 79% of COVID-19 related deaths in DC have been Black residents, who only make up about 46% of the population. What do you see as some of the underlying factors contributing to these disparities, and what would you do to tackle them?
Well, one of the things that I say in terms of my candidacy is that Stuart is not doing anything or seeking to do anything that he wasn't already seeking to do. So I've already been addressing systemic inequalities throughout our community and region. And so I just want to be able to be in a position to do it from a different strategic standpoint. As a council member, I would be able to really leverage the relationships that I have with some of the other council members. And the underlying factors contributing to the systemic inequalities in DC are income, that educational gap, access to health care, and access to food, right? And I want to say a little something about each one of those, so that if your nutrition level is not where it should be, you can't learn. Children can't learn. Our children are starving. And therefore that exacerbates that educational gap. And if your health is not, if you don't get a good night's sleep, if you're suffering from asthmatic symptoms and things, you can't learn. So each of these things reinforce each other. And most people know that I was a pivotal linchpin, if you will, in the spoke of the wheel for the food walk that we had over here in Ward 8, the highlight, and this was 3.5 years ago. It's unconscionable that the council as a whole has not addressed the inequalities in access to food east of the Anacostia River. So one of the things that I would do is I would continue to push it, but I'd be pushing it from being a legislator down there at the Wilson building, saying, no, we're not going to talk about that till we address this healthcare situation. We don't need a hospital. We need a hospital with trauma 2 level capability. That's what we need. We must have. This pandemic has said nothing else. It said that we need that east of the Anacostia River. If I have my way, it'll be in Ward 8. And that's true about each of those issues that I talked about. I'm going to push for those issues. That's my platform. That's it. That's it. Education, closing the gap, getting the healthcare system in place east of the Anacostia River, and creating greater access to food, which will solve some of the systemic inequalities that we see. And again, a comprehensive address is what's needed. The inequalities which might work to moderate income inequalities are all wrapped into that, and trying to figure out how we got great programs. We just need to link those programs to real jobs so that people can get a living wage. And then we can address the prejudices, the stereotypes, and the cultural norms that also need to be reinforced. So I think that's where my campaign is. It's square in the middle of addressing this particular question. In the mid of COVID-19, we can't do anything less than to address these things in a real kind of urgent manner. It is an urgent manner that we begin to take care of people. And these issues that I just spoke are the ones we really got to look at.
Hi, my name's Nate Derenge. I'm running for DC Council as Ward 8 representative.
Approximately 90,000 families live in apartments that are under DC's rent control program, which is currently up for reauthorization. The DC Council's temporary universal ban on all rent increases exposes the need for increased tenant protections. What changes, if any, would you make to DC's rent control laws?
I think when it comes to DC's rent control laws, as a council member, I really can't do that much. I'd have to do legislation, have 12 co-sponsors, and that'd be the real way to get something done that would be meaningful to all the renters in DC. Right now, my platform shows to make rent more affordable. It's just to increase the supply of housing and hopefully get people better jobs and greater economic opportunity so they can have more choice and more freedom of where they want to live, where they can best thrive and prosper for their family. And so I like to focus on increasing the supply of housing to get the price down, as well as helping increase people's incomes so they have more choice and more freedom. And then they don't have to play games in the system of rent control that's kind of full of inequalities. So that's where I like to focus when it comes to handling rent control.
Okay, great, thanks. Let's see. The City Council has enacted legislation that prohibits rent increases during the state of emergency and prohibits evictions until 30 days after the public health crisis has been ended. We know that nationally 1/3 of tenants could not pay their rent on April 1st. Given that over 87,000 DC workers have filed for unemployment in the last month, that statistic may be higher in the district. While the courts in DC are closed to the public, landlords continue to file eviction cases online so that they can push evictions through as soon as possible. As the crisis continues, tenants will continue to fall behind on their rent and accrue a debt, What would you do to address this issue if you were on the council now?
If I was on the council now, I would have got DC opened as soon as possible, and really like a month ago. By having DC shut down, there's more people on the corners of Minnesota and Pennsylvania who can't work because their company where they were working, moving offices, isn't moving offices now. So by shutting down the city, like the district shutdown has really hurt a lot of people in Ward 8 and their ability to make an income. And so my response would have been open up DC, open it up early, tell those at risk who are vulnerable, tell them to stay inside and control their risks and to be careful. But for people who already have the antibodies and the young healthy folks who are less of a risk, who want to work and are able to work, and then they can make that money to pay their rent, I would encourage them to do that. So my response would be, don't shut down DC. DC is pretty slow when it comes to opening up. And compared to other places around the world and other cities in America, DC can open, and we can do it safely and smartly, still protecting our elderly, but letting our younger and more less risk people to continue to work. So that would be my response.
Okay, great. The third question. The DC Housing Authority states that the 6,600 plus units of public housing need up to $2.5 billion in deferred maintenance and capital improvements. And the agency has charted a 20-year redevelopment plan. What would you like to see happen in public housing, and what would you do?
Having billions of dollars of improvements that's a huge amount. The city doesn't even have that money anymore because it's been using it during this coronavirus pandemic where DC shut down when it didn't need to shut down as much as it did. So this is a self-inflicted problem. We could have made it a lot better on ourselves and had more funds to help improve these places that need serious improvement. So I think that prevention is the best medicine just for healthy living in general, and also when making policies as a legislator or any type of political figure. And so I think, yeah, this problem would be a lot better to solve if we had more money and we didn't go through all of our rainy day fund as a district. So that's what I wish would have happened. And then we wouldn't have to, and that'd be a lot easier to solve that problem of how to clean up the public housing units.
Fourth question. From encampment clearings to the threat of COVID outbreaks in shelters, we know that the DC's homeless services programs are not working for many residents. How would you ensure that all DC residents have safe, quality, and affordable housing?
Well, I am thankful for the dozens and dozens of organizations that work to fight homelessness and give people a place to stay, a place to get back on their feet, and just a lot of hope in order to secure a job and to make an income and to get a home. So I am thankful for a lot of the ministries, nonprofits that are doing work with that. And then my other thing I'd like to do, which is pretty much the one of the big points of my campaign, is to increase economic opportunity. And so people can get more jobs, and there's more job opportunities to bring yourself in some greater income to find yourself a place that you want to live. And so I think whenever the job creators create more jobs, that is just the driver of so many other issues and problems in our society. So my response is to continue to have more economic opportunity by not shutting down the city, and encouraging more, having people get some jobs to bring in some income to then provide for their housing needs.
So the fifth question it's a little bit different. It's not a 3-minute question. It's a 1-minute question. So keep it really short. We've talked about DC's affordable housing crisis with respect to rent control, public housing, and homelessness. What would be your top 3 priorities related to housing as a council member? Please just list them.
When it comes to my priorities for housing, my priorities really connect to a host of other social and economic issues. So my priorities are, number 1, economic opportunity, especially in Ward 8 where there's a lot of development, a lot of good future jobs coming in, and when there's more economic opportunity, there's a lot more housing occurring when it comes to housing development. And so, yeah, my platform is economic opportunity. The second part is safety. Safety is really important for communities. If you don't feel safe, you're not going to go out and engage in commerce. And then finally, my platform is close to economic opportunity. We remember all those community members who have lived in my ward for a long time and make sure they don't get left behind. So ensuring that they have jobs that they can secure and continue to live where they've been living in the places that they've called home.
Great. Sixth question, getting close to the end here. The impacts of the coronavirus have also revealed the lack of a real safety net for workers in DC, particularly undocumented workers and those working in the informal and gig economy. How would you address these issues?
I think my personal way of answering these issues is to reopen up DC, and so those workers who are in the gig economy or in some other unstable employment have more job opportunities. So my answer would be to open up DC and let those who are able to work to go out and get a job, and they can provide for themselves. And that would be, I think that's the best way personally to address the issues of safety nets in DC, is having some more job opportunities.
Now we're reaching the end, or we're at the end. Seventh question. The coronavirus pandemic has brought to the forefront issues of systemic inequalities in DC. We know that 79% of the COVID-related deaths in DC were Black residents, who only make up about 46% of the population. What do you see as some of the underlying factors contributing to these disparities, and what would you do to tackle them?
I think when it comes to the unfortunate deaths of the DC residents who have fatally contracted this illness, I think that some factors that DC hasn't reported in as other pre-existing conditions. Unfortunately, the district website doesn't show on the deaths how if other people had other medical conditions with lung issues or compromised immune systems. So I'm pretty sure that's a factor for the fatalities, which the DC task force and the mayor's office, I wish they'd be a lot more open with that data collection, sharing that data. The other factor for coronavirus fatalities seems to be age. I saw recently last week, the numbers from last week, and it was a lot of 70s, 80s, 90-year-old residents. And that's just something I've noticed. And so I think, I just wish DC was a little more open with their data, and they'd open up the district. And then whatever disparities there may be in certain populations, there'd be way more economic opportunity for everybody to, they'll provide for themselves and their families if DC was open. And hopefully that'll shorten the disparities when we all are free and able to work and provide income if we're allowed to do so.
Good evening, everyone. My name is Yaida Ford. I'm running for Ward 8 City Council. Very proud 15-year resident of Ward 8. I'm an attorney. I practice civil rights law and HOA condo law here in the district. And I'm interested in creating opportunities for Ward 8 residents and fighting for us at the council level, where we desperately need an advocate on several issues, from the health disparities to housing issues and responsible economic development. And I'm looking forward to answering questions. And you can find out more about me at yaidaford.com or on social media at Yaida Ford for Ward 8. That's my Facebook page.
So approximately 90,000 families live in apartments that are under DC's rent control program, which is currently up for reauthorization. The DC Council's temporary universal ban on all rent increases exposes the need for increased tenant protections. What changes, if any, would you make to DC's rent control laws?
I think one of the things that would strengthen the rent control laws that we have would be to address some of the loopholes related to voluntary agreements. And, because what happens is, the voluntary agreements kind of allow landlords to negotiate these rents with tenants, right? In exchange for improvements to, to the property, and the property owners can use them and have used them to do away with rent control altogether. And there's nothing that says that that's illegal per se, right? So I think just based on the numbers I know, or the recent numbers that I looked at since 2006, there have been maybe 240 voluntary agreements, and you'll have a current tenant signing away rent control for the future tenant, right? So that's very, very problematic. I think that would be one of the first areas I would start, is to tighten up the legislation so that it would do away with voluntary agreements or make them illegal. And I think that that's an important place to start. Also, the notion of raising rents for improvements and repairs, knowing that is, kind of a necessity for some landlords, but it should be maxed out, I think. I don't think that a landlord should be able to raise rent to make repairs for an indefinite period of time or permanently. I think it should be temporary to permit the landlord to make those improvements, and then the rent should go back down. And, I don't know I guess I still have some time, but also, I would consider, requiring rent stabilization for housing that's built before 2005, and then something for newly constructed homes once they're a certain age, and once they get to a certain age, making rent stabilization a requirement for them. Capping annual rent increases, I think that would also is important so that we could continue to make housing affordable. And to create, because we just have an ever shrinking pool of affordable housing. So those are just a few of my ideas, or ideas that I support. They're not novel ideas, but ideas that I definitely support.
This one's a little bit long. The City Council has enacted legislation that prohibits rent increases during the state of emergency and prohibits evictions until 30 days after the public health crisis has ended. We know that nationally, 1/3 of tenants could not pay their rent on April 1st, given that over 87,000 DC workers have filed for unemployment in the last month. That statistic may be higher in the district. While the courts in DC are closed to the public, landlords continue to file eviction cases online so that they can push evictions through as soon as possible. As the crisis continues, tenants will continue to fall behind on their rent and accrue a debt. What would you do to address this if you were on the council now?
I would propose, I kind of, like the federal approach to this, and I would definitely propose stopping evictions on properties that have federally backed mortgages, with 1 to 4 units, and properties that have federally backed multifamily mortgage loans. So that would be 5 units or more. Also, ceasing late fees and penalties where, on tenants where the property owner is getting that type of relief. It's only fair, right, to do that. Or, where properties where landlords have received a forbearance, it's clear that they received a forbearance, they should be passing that on to tenants.
Okay, so the DC Housing Authority states that the 6,600 plus units of public housing need up to $2.5 billion in deferred maintenance and capital improvements, and the agency has charted a 20-year redevelopment plan. What would you like to see happen in public housing, and what would you do if you were on the council?
Yeah, so thank you. This is a great question, and it's tough because, the Trump administration has proposed cuts, to the federal budget for affordable housing. So we'd be relying on, local funds exclusively. And so I think I like the idea of seeing a schedule for making repairs in public housing, beginning with, 25 million. And I've seen this proposal and I do support it over the next 2 years, and 15 million per year for 10 years, because it would allow the housing authority to issue bonds. And I think that's important. And, I've heard the idea of, the notion about using private capital, which it's not horrific altogether, but the question is whether that would privatize public housing, which is not what we want, right? So.
Yep. Great, thank you.
Open to different options, but I really think that the schedule that would allow the housing authority to issue bonds would be effective.
Okay, thank you. Okay, so the next question number 4, we have 7 total, just so you know. From encampment clearings to the threat of COVID outbreaks in shelters, we know that DC's homeless services programs are not working for many residents. How would you ensure that all DC residents have safe, quality, and affordable housing?
So, you know, some of the alternatives to homeless shelters and congregate settings and encampments, and it's really disturbing, you know, the number of cases of COVID-19, at least that we know about within the homeless community. And, you know, again, those are only the ones that we know about, you know, more than 150 as of April 26th. And the numbers that we know are more than that. But, you know, I think that particularly when we have people living in congregate settings and encampments, being innovative about the way we're addressing this for our homeless men and women. You know, we can use it. We know hotels are empty right now for the most part. You know, I have friends that work at Marriott and some of the really big hotels, and they're completely empty. And, you know, designating, you know, a floor or 2 or however many, you know, with certain hotels and creating an agreement with those hotels. To just have a section, you know, where we can create safe space for, you know, men and women who are otherwise living in really unsafe settings. You know, and I've definitely, you know, heard the idea about dormitory units with social workers. I think you can do that anywhere. I think wherever you do it, whether you do it in a hotel space, which is clearly not being used. And, you know, I know that would cost some money, and the hotel would have to operate and have staff. But I think that one of the key things is making sure that when we're housing, you know, particularly our men and women from the homeless community, that we have the necessary things that they need so that they can eat, that they will have the toiletries and the things that they need to live. And, you know, the mental health professionals and social workers that they need, or the staffing that they need, to make this space one that's prayerfully like transitional for them, so that they're not going, you know, the concern is you put them in a space and then what happens when this is over? Where do they go? So I would like to see, that would be one of the things that I would love to work on, is a transitional plan. Like if we can get them into a space, okay, now how do we work on keeping them or putting them somewhere where they can continue to get the help that they need? Because when they're not on the street, they're just ultimately altogether unstable.
Great, thank you. Okay, so this is the 1-minute question. So I'm sure you're ready for it. So we've talked about DC's affordable housing crisis with respect to rent control, public housing, and homelessness. What would be your top 3 priorities related to housing as a council member? And you can just list them.
Definitely the repairs in public housing, the homelessness issue that is ever increasing, and housing for seniors and those with HIV. Great,
thank you. Okay, I think we have 2 more. And these 2 last ones are 3-minute questions. So, or you have up till 3 minutes, you can take whatever you want. Okay, so the impacts of the coronavirus have also revealed the lack of a real safety net for workers in DC, particularly undocumented workers and those working in the informal and gig economy. How would you address these issues?
You know, if DC had the funding, I would recommend a stimulus payment to undocs who are out of work. You know, we're a sanctuary city. You know, and so I think that making sure that they get some type of stimulus payment as well. And I know that just like everybody else, and I would also, you know, we offer unemployment insurance, which is fantastic, but I would proffer to extend that for a few months beyond the end of the stay-at-home order, whenever that is, that they get extra additional unemployment insurance for a certain amount of time after the stay-at-home order, just like, you know, the certain relief that other district residents get, that our undocs will get that support, because we don't know how long it would take for the gig economy to get back up and running. I mean, certainly, you know, and then the other thing that's so unpredictable is that we don't know how soon people are going to be ready to spend money. When we
Oh no, you muted yourself really quickly.
Sorry, it got muted because somebody was just calling in. But I think that with, you know, the way the economy, we don't know what that bounce back is going to look like. So extending it for a certain period of time, extending you unemployment insurance for a certain period of time, and then just kind of reviewing that and seeing, how long it will take for people to get back to work, will provide extra support for our undocumented workers.
Great, thanks. Okay, last but not least. The coronavirus pandemic has brought to the forefront issues of systemic inequalities in DC. We know that 79% of the COVID-19 related deaths as of 4/14 in DC were Black residents, who make up only 46% of the population. What do you see as some of the underlying factors contributing to these disparities, and what would you do to tackle them?
Prior to COVID-19, Black people have dealt with the social determinants of health for a long time. And that is the cause of a lot of our issues. And I tell people, when we're in conversation about COVID-19 and it's like, oh, so many Black people are dying. And it's like, well, I would say that, there are things that make COVID-19 or have made it more fatal to Black people, than, it's affecting us more. It's definitely, there are factors that just make it difficult for us to survive something like that. And again, when I mean the social determinants of health, things were already bad for Black people in Ward 8. The lack of access to healthy food is one, lack of access to green space, stressors from poverty. All of these things have created conditions for us before the virus that pre-existed COVID-19. So again, the virus is just more fatal to us when we're already dealing with a bunch of issues, particularly stressors that in our lives that basically are economically induced stressors. We also have trauma-induced stressors that we're dealing with. That and not getting tested, and just not knowing. Life is difficult and nightmarish for a lot of Ward 8 residents on many levels. So this is an issue that can't be solved overnight, and we definitely have to deal with some of the trauma behind things that create a horrific environment, and that create these social determinants of health that make it difficult for us. One of them being, the lack of a full service hospital in Ward 8. That seems like, oh, that's obvious to a lot of people, like, oh, how could you not have a full service hospital? But we don't. And that's been in conversation. And, I don't think it should be a politicized conversation. I think we just need to address why we don't have that and what the needs of the ward are, and just looking at the numbers and the figures and why it's important for us to have that. And I think that COVID-19 has just directed a spotlight on the disparities, but the social determinants of health has been something that we've been dealing with in Ward 8 and east of the river for a long time.